Hi guys, you are tuning in to the first episode of Think Tenacity podcast show. So without further ado, I would love to introduce my very first guest, Barbara Toombs, who is an occupational lead, and we're actually at her offices. So without further ado, Barbara, would you love to introduce yourself?
Hiya Bella, thank you so much for inviting me today. My name is Barbara Toombs and I'm an occupational therapist by background, and I'm the occupational therapy lead for Barking and Dagenham, which is part of North East London Foundation Trust.
Fantastic. Thank you, Barbara, for being the first on my show. And I know we go back a while where I did my first speaking engagement in Barking, and you were one of the speakers. So thank you again for that. And also being an ear on the phone if I need to call you to get advice. And learning about what you do has been excellent. And I can't wait to share with the audience. So without further ado, could you tell us a bit more, what is NELF, the NHS Foundation Trust?
So NELF stands for North East London Foundation Trust. So we're a very large NHS trust. We cover Barking and Dagenham, Waltham Forest, Redbridge and Havering, and we also cover parts of Essex and North London and Barnet. We provide integrated services for individuals with both mental health and physical health problems. My focus though is mental health specific.
Fantastic. And how long have you been an employee for NELF?
Well, I've been an employee for NELF and its sort of predecessors. It changes over the time.
Yes.
Since essentially I graduated, which was in the end of 1991.
Wow. So you've probably seen a lot of changes.
I have indeed. I have indeed.
So could you clearly describe your role? Because I know your role has changed. What is the job title? And then you could explain exactly what that entails.
So at the moment, I'm actually covering two roles.
Right.
I'm interim head of mental health in Barking and Dagenham, but also my substantive role is as lead occupational therapist. Occupational therapy focuses on promoting recovery for anybody with any level of illness, whether that be physical health illness or mental health illness. And it is really focusing on what people can do rather than what they cannot do despite their illness. So we really focus on people's daily living skills, so being able to wash, dress, cook, manage their roles, manage their routines, and essentially get back to an ordinary life again in spite of any illness or symptoms that they experience. So I have a team of occupational therapists who work with me in a variety of different settings, all with the same aim to promote the recovery of the individual and support that person to be in control of their life. And in particular with mental health, is to feel in control of their symptoms rather than their symptoms controlling them. So the nice thing about occupational therapy is we do see people and we do support people in moving on in their recovery. And the focus is less on the symptoms but more on people's abilities and promoting people's abilities.
That's fantastic. And also, does your role still cover helping employers as well?
So at the moment, I'm working on a pilot project in Barking and Dagenham. We have national funding from the government to integrate employment specialists in our mental health teams. So I'm working alongside the CCG, the Clinical Commissioning Group, who commission services in the borough, and also the local authority to fund employment advisors to be embedded in our teams. Because evidence shows if people are at work or if people have productive activities to enjoy during the day, their mental health improves.
Fantastic. So let's start off by defining and understanding what is a mental health illness.
So mental health is different things to different people.
Right.
Everybody experiences mental ill health at some point in their life. The statistics say that 1 in 3 or 1 in 4 people experience mental illness, but it doesn't necessarily mean that you need to seek support for that.
Yes.
So mental ill health, just like we all have physical health, So, you know, at times in our lives, our physical health may not be great. You might suffer from a back problem, you might suffer from migraines, you might suffer from asthma, you might suffer from the flu. So your physical health will fluctuate. And
so just like your mind and stresses as well may fluctuate.
And so it's very much in terms of your mental health, we all have mental health, and there are times when our mental health potentially won't be so good. And usually life events, you know, we might be undergoing stressful times in our life. It might be a relationship problem, it could be work-related stress, it could be familial problems, a bereavement, when our mental health will suffer. It doesn't necessarily mean we need to seek help for it.
Sure.
When individuals suffer from, you know, continual, say, low mood, feeling hopeless or helpless, it might be that they're depressed and they do need some support around that. Or similarly, if people feel maybe their thinking is a bit out of touch with reality, they might have thoughts that other people don't share. So those experiences don't feel normal or comfortable for them. That's when they may need help as well. Just sometimes struggling to get up out of bed and to get on with a normal routine. When the normality changes, that's when it might become a problem, and it's much better to seek support in the early stages. So mental illness can be related to somebody's mood. They might feel their mood is low, or equally their mood is very excitable, quite high. It could be around their thoughts not being necessarily ones other people share, slightly out of touch with reality. Or it could be around people, you know, using substances which may be are becoming a problem, whether that be alcohol or substances, drugs that aren't prescribed by.
Excellent. And to show the audience, there are so many different forms and types of mental health, even dementia, eating disorder. Can you just list some of the different types so they're aware? Because I have bipolar and depression is very common. What are the other types of different mental health?
So we sort of classify them in two classifications. One would be a mood-related illness. So that would be any illness that affects your mood. So it could include depression, it could include bipolar illness, it could include anxiety, maybe some eating disorders, and then we have more psychotic illnesses. So we usually define those as illnesses such as schizophrenia. There is a misnomer around schizophrenia, and funnily enough, I had a conversation with a friend the other day. A lot of people think schizophrenia is a split personality, which it's not. Schizophrenia is usually defined as an illness where somebody's experiencing symptoms around psychosis. So it might be beliefs that other people don't share. It might be that we call those delusions. It could also be experiencing symptoms which we call hallucinations.
Yes.
And there are many types of those. So they might hear things or see things or smell things that other people don't.
Sure.
So that would be illnesses on the psychotic spectrum.
Yes.
But you can have some people with symptoms of both.
Yes.
So with some mood-related illnesses and sometimes some psychosis as well. You know, in particular if somebody becomes very, very depressed, oftentimes there can be some level of psychosis as well, just because they're so depressed. And when the depression is treated, the psychosis then disappears. So it's very difficult, and that's why psychiatrists won't necessarily label somebody with a diagnosis straight away, because it can be unclear, and oftentimes they'll have to see that patient a few times.
Takes time
before it's clear. Because giving somebody a label, especially with a condition that maybe has some negative connotations, it's not something that they will want to do straight away. Having said that, a lot of individuals know that there's something wrong with them, and actually being given a diagnosis takes a bit of a weight off their shoulders, because they realise actually what I've been experiencing is real, and there is a diagnosis, and therefore there is treatment that can follow.
You touched on something that was significant. The first thing was, when you feel you're having mental health challenges, it is over time. So it may not just be the one day I'm not feeling great, it's progressive. And the other thing that you touched on was when you do have a mental health diagnosis, it could be more than one. So you could have anxiety with something else, you could have depression with schizophrenia with bipolar. So it does take some time. So I think there's a big significance that with mental health, it is a time element.
Well, we wouldn't diagnose somebody necessarily with, say, schizophrenia and bipolar. What you tend to find is some conditions like schizophrenia will have symptoms that are similar to a bipolar illness as well. So you might suffer from schizophrenia, but your mood might also fluctuate. So rather than being given a diagnosis of schizophrenia, you might be given a diagnosis of schizoaffective disorder. Because your affect is your mood, so there's a little bit of both. But I tend to focus less on the diagnosis and more, because we're all individual, and I might suffer from depression, and my colleague next to me might suffer from depression, but actually how we present and how our symptoms affect us might be different, because we're different people, different personalities, maybe different level of resilience. So clinically, while we're very aware of somebody's diagnosis, as OTs, occupational therapists, we will look at more how is that illness impacting the person's day-to-day life, and what are their strengths and what are their skills that we can focus on to help them overcome. Yeah.
Excellent. I wanted to just touch on some of the type of mental illnesses that some of the audience may be a bit more familiar with, and some of the symptoms that they may be having. For example, anxiety is a wide-ranging type, but just for the audience, in case they're having some of the symptoms, what are some of the symptoms like for anxiety?
So anxiety is a very natural and very normal symptom to experience. It is basically, it's quite a prehistoric inbuilt mechanism to suffer from what we call stress. There is a stress cycle. And it dates back to, as I said, prehistoric times.
Wow.
When we were cavemen and cavewomen.
Yes.
And when we experienced danger and we were potentially at threat or at risk of attack, we either fight or else we'd fly. So it's called the fight or flight mechanism.
I've heard that before,
So in order to either fight or to flee the situation, you basically need a lot of energy so your muscles can work, so you can either fight or you can run.
Because it has a physical element to it as well.
And so because we sense danger, the fight or flight mechanism kicks in to enable us to escape that threat that we perceive to be there. So in order to escape, your muscles have to work. So blood is pumped to the muscles in your body to run. In order to pump the oxygenated blood, your heart has to beat faster. And so when nowadays, obviously we're no longer cavemen and cavewomen, but if we experience a situation that we perceive to be anxiety-provoking or stressful, automatically our fight or flight mechanism kicks in. So your heart is going to start beating faster to pump oxygenated blood around your body, in particular to your limbs, to your extremities. And your lungs are going to want to take in more oxygen, so you're breathing much quicker. So the symptoms of anxiety tend to be that fast breathing, and that's because your body's trying to get more oxygen in, your heart pumping quicker, and people can say, I can hear my heart in my head, and that's because the heart is pumping blood to those limbs. People also suggest they feel lightheaded and maybe feel clammy in their hands and lightheaded in their head, and that's because the blood is being diverted to their legs so they can run, and to their arms so they can physically fight. And so what we need to remember is it's a natural reaction to that sense of stress. But unfortunately, sometimes when people experience that stress cycle frequently, the perception of that stress becomes heightened. And a little bit of stress kicks that stress cycle in, and they begin feeling those symptoms of anxiety quicker, even if it's not necessarily a very stressful situation. Everybody feels that, and it's really important. If we didn't have stress in our lives, we wouldn't get up, we wouldn't be motivated to do anything.
It's almost like a detector telling us our bodies and minds something.
Absolutely. So when we are feeling stressed, if it's a situation, and I've been in situations I can remember as a teenager, coming home late at night from a disco and walking down a dark road and thinking, I'm alone, I'm a female, I need to run quickly to get home so I'm safe. And that's really helpful. It helps you keep yourself safe. But in situations now when people feel stressed, when there isn't any perceived stress, what we have to do is we have to try and slow that stress cycle down.
Right.
So people need to just breathe slower, slow their breathing down.
Yes.
And in their head, just reminding themselves that actually they're not in any stressful situation. There isn't any risk. That takes a lot of practice, and sometimes for individuals it takes the help of a therapist to do that.
Right.
And that's where CBT, cognitive behavioural therapy, can be really helpful, because it's almost getting that individual to rethink things through and have a different formulation for those stress reactions.
So I'm happy you presented that for the audience who may have some anxiety symptoms, that there's treatment out there and there's a way out.
Absolutely.
That's fantastic.
There is medical, in terms of medication, there is medication that can be prescribed as well.
For anxiety.
Okay. So an antidepressant medication which will tackle anxiety as well. But in the end of the day, the CBT together with maybe an antidepressant, when anxiety is very severe, that is evidence shows that that's the best form of treatment.
And in general, with regards to medication, would you say medication can be a variety dependent on the patient? Because some patients may not like taking pills and medication. So do occupational therapists like yourself and a psychiatrist work with those mental health patients to give them an ease or choice on what they can choose?
Absolutely. Medication is prescribed by a psychiatrist.
Yes.
That's their speciality.
Yes.
And there are a lot of different medications. It's really important to remember that nowadays modern medications for mental illness have much less side effects than maybe the historical old type of medications. And that's important because maybe our parents or grandparents, if they were treated, had very different medications. So modern medications are much better in terms of the numbers of side effects that may be experienced. Obviously, when you're prescribed any medication, whether it be for physical or mental health, you will be told what the potential side effects are. That said, with mental health medication, for example, antidepressants, there's a range of antidepressants, modern antidepressant medication, which can be tried. And for some individuals, like I mentioned earlier, we're all very different. Our metabolism is different and how our bodies cope with medication is different. So normally if somebody's being started on a medication, they'd be started on a starting dose.
Yes.
And then gradually it will be increased to a level where it's actually what we call therapeutic. It's working.
Yes.
We avoid over-medicating anybody.
Yes.
So there's a range of different medications, and within that range there's lots of different ways it can be taken.
Right.
So some medications, if people struggle to swallow tablets,
because that's the biggest common one. Even people without mental health don't even like taking vitamins.
So some medications, not all are available.
Not everybody likes taking tablets.
No. So if somebody wants to take medication and it is recommended by a psychiatrist or by their GP, then some medication can come in liquid form, like a syrup.
Yes.
And some can come in dissolvable tabs that you put on your tongue. A lot will be in pill form. Some medications come in also in injectable form. They will be generally those antipsychotic medications.
Fantastic.
But medication is one part of treatment.
Yes.
But it's not the be-all and end-all.
Yes.
So medication can help to lift somebody's mood or to maybe reduce some of the symptoms they're experiencing. so that they're then at a point when they can engage more fully with maybe psychology or counselling, or with an occupational therapist to engage in activities.
Sure.
So while I would encourage somebody to try medication if their symptoms are very severe, there's therapy, there's a lot of therapy which is available. Either via the GP or via a psychiatrist in secondary mental health care.
Fantastic. I'm diagnosed with bipolar, and bipolar consists of manic and depression. I suffer more with depression. Could you share with the audience what is bipolar and the definition?
So bipolar illness used to be called manic depression, but we no longer call it manic depression. So it's a variation in mood, usually more extremes in mood, but it doesn't mean that somebody necessarily has to fluctuate between having very low depressed mood and then very high elated mood. Some people have more cycles of low mood and then maybe an increased elevated mood. But it doesn't necessarily peak and trough, as you would see a graph. Again, it's very individual to that person. If somebody's experiencing those very low moods, those feelings of depression, the common symptoms of a depression would be similar. So they would be feeling hopeless about the future, feeling helpless about the current situation. It might, the individual might really struggle to sleep. So sleep disturbance. They might struggle having any appetite. Oftentimes people say they struggle getting out of bed, isolate themselves from other people. The idea of actually getting up to have to go to work or going to socially meet people is just the last thing that is on that person's mind, and almost want to sort of pull the covers over and stay there until it passes. Alternatively, somebody with an elevated mood can feel that they've got boundless energy, again have sleep problems because they don't need to feel that they have to sleep. They might find that they're over familiar with other people, so very excitable, making friends with lots of people, feeling that they can do anything and everything. Oftentimes you might have symptoms that somebody is overspending money that maybe they don't have because they have lots of plans, lots of great ideas. And it can be quite challenging for us working with somebody who has more of the higher elevated moods, because it's a nice feeling to have, and taking medication that might suppress those happy feelings, it is a challenge, and it's important that when we treat somebody who's quite manic in mood, that the treatment doesn't bring them down into depression. Exactly. So it's trying to get that balance. With a mood stabilizing medication.
I'm so happy you touched on the symptoms of depression, and that was my motivation more for Think Tenacity podcast show, to really talk about depression. And I would like, if you could, to maybe just cover just a misconception about depression, because those that may not have gone through depression, it's easy to say, oh, you're just down, but where you highlighted with depression, and I know what it feels like, you literally can't get out of bed, you lose confidence, sometimes my memory loss goes, and the appetite is also linked to memory loss because I can't even remember how to cook. So what's your recommendation on the misconceptions of depression? It's not just that bad day you're having.
Absolutely, 100% agree. And what you mentioned about memory, that's a very, very, very common symptom, is poor concentration. So somebody will say to me, I'll watch, I'm watching EastEnders. I don't watch EastEnders, by the way, but I'm watching EastEnders, and I can sit and watch the whole programme, but if you ask me at the end what happened, I wouldn't be able to tell you.
Right, I'm so glad you said that. Because often people say, come to the cinema. And I actually don't like going to the cinema because I think it's a waste of time. I don't mind the popcorn and the gummy bears, that's all great. But I've sat there, Barbara, for an hour and a half. Even if it's a movie star, I couldn't tell you what was what.
And the same thing people will say to me, I'll read a book or I'll read a chapter, and again, I know I've read the words, but I haven't absorbed what's there. And that's because that person's concentration has been affected.
Right.
Now, none of those symptoms are permanent.
Yes.
And that's really important because it can be quite frightening if you think I'm not remembering
absolutely.
things. But it's very much not permanent.
Mm-hmm.
And obviously when the symptoms of depression improve, then people's concentration returns.
Absolutely, because I notice the difference. And I always say it's a bit like having a cold or flu. Because when I'm better and I can read a book, I can cook a curry or cook even beans on toast,
Exactly.
I realise, okay, at that period I wasn't well.
But going back to your question though, there's a huge difference, as you've identified, between having a bad day.
Because we all, most people, even without mental health,
Absolutely.
have a bad day.
Because life throws these curveballs at us. You can be at work and, you know, overloaded with things. You can be at home and a relative is ill, a friend, you've had an argument with a friend and that's upsetting you. So we all have bad days, we all have bad weeks. It's when that's consistent and it doesn't improve and it is beginning to impact on your day-to-day functioning. So you're not getting out of bed, you're not washing yourself, you're struggling to make contact, going to play football that you normally play on a Monday evening, you don't want to go there anymore, you're giving excuses why you don't want to see your friends on a Friday at the pub, or you're becoming much more tearful, and it's not like you. That's when it's probably dipping into more of a clinical depression, rather than I'm just having a bad week. Because we all have bad weeks.
Absolutely.
Absolutely.
And I love the way you clearly explained when depression becomes a problem, when your day-to-day is affected or you're making excuses socially. What advice would you give to the audience if they are listening and identify with some of the symptoms of what they call? What would you say steps they should do or seek help, because they may not know what to do? What should be the next step?
I think if the advice I'd give anybody is to speak to somebody you trust, whether it's a family member or a friend, and also speak to your GP. Because like any illness, if you can nip it in the bud, so to speak, you're much more likely to have a quicker recovery than leaving things and to get, I suppose, more entrenched.
Yes.
And for symptoms to worsen.
Absolutely.
What we haven't touched on, and it is really important, is that oftentimes people might also experience symptoms to harm themselves. Or thoughts that they actually may not want to be here anymore. And it's really important that we talk about that, because avoiding those topics, because people might find that uncomfortable, is just avoiding something that's quite serious. Sure. And so it is actually quite common for people to have either thoughts to harm themselves, but when it dips into somebody having plans, so maybe thinking about, and obviously we've seen recently, unfortunately last weekend, the case with Caroline Flack. It's so important that you speak to
try not to get to that stage.
Absolutely.
Thank you for sharing that. And I would like to also ask, and for you to share, there are other wonderful organisations and charities. Would you suggest some for the audience that you particularly
So in terms of, I suppose, crisis help, I would definitely suggest people call the Samaritans, because they're always available, and sometimes having just it's somebody different, somebody that's not necessarily close to you, somebody more objective that you can just talk to.
Yes, a third person.
Absolutely, because not everybody has somebody they feel they can trust and they can confide in. So the Samaritans Mind are also very good. So I'd suggest Mind in terms of that crisis support. And then there are lots of charities out there that will help people with some of the triggers, some of maybe the social issues that people are experiencing that are leading to their depression or their anxiety. So for example, with financial problems, the Citizens Advice are really great. And the Citizens Advice centres in every area. So contact Citizens Advice if you're having financial problems. Because now in this day and age, financial issues are everybody's got financial concerns and worries and debts. And again, like anything, if you can resolve those and get support with any of those at an early stage, it actually saves an awful lot of problems further down the line.
Fantastic. I'm particularly looking forward to celebrating Mental Health Week, which starts 18th of May to the 24th of May, and every year they have a theme. The theme is sleep, and I'm really happy they chose sleep, because I believe sleep is important for everybody. Babies, the grandparents, wherever you've got a mental health or not, everybody needs, and it actually helps with aging and wrinkle. So can you give some tips about why sleep is important for mental health, and any tips to have a good night's sleep?
Well, as you say, we are all, we all live very, very busy lives.
Yes.
Probably busier than at any other time before.
Yes.
And oftentimes we prioritise other things over sleep.
Yes.
And obviously the evidence in terms of physical health, your physical well-being, we need sleep, and as well as your mental well-being. You can't separate the two. If you're physically not well, that will affect your mental health. If you're mentally unwell, your physical health is affected. We're not two separate beings. We're one whole body, and one interacts with the other. So sleep is really important. To get a good night's sleep, especially in this day and age when we're all busy on iPads, iPhones,
yes,
and other Android phones,
yes.
I will say. Obviously social media is 24/7. And it's very hard oftentimes to put those things down. But in order to get a good night's sleep, you have to begin to wind down, maybe an hour or so.
Wind down before sleeping.
Yeah. And that means putting down the iPad, putting down your phone.
Not looking at an email, just about you're going to close your eye.
Definitely not. Not eating just before you go to bed.
Right.
So making sure you're eating in advance so that food is digested and you're not lying on a heavy tummy. So I'd say put away all your electronic devices. Oftentimes to help people sleep, make sure you're in a comfortable bed. There's nothing worse than an uncomfortable mattress, etc. So making sure you're in a comfortable bed. The room temperature is as you like it. If you're too hot, you're going to be tossing and turning. Equally, if you're too cold. As I said, turn off the devices. Sometimes if you're struggling to sleep, having soothing music, everybody's different. There are lots of, turn off your devices, there are a lot of good apps that you can download on your phone,
yes.
which will have, they're sleep-themed apps. And there's a very different variety, and different ones will suit different people. So you might have soothing music, or you might have somebody talking. And we all, it's a little bit like tastes of food. Everybody's different tastes. So some of the apps can be helpful to play in the background as sort of white noise, and will help people to sleep. Making sure that as I said, there's no chance for people interrupting you. So put your phone away, so you don't have a phone turned on, so that somebody's going to phone you in the middle of the night, unless it's an emergency. Obviously, if you're caring for an elderly family member, you might want to keep it on, but just to avoid that, maybe have it muted. Just giving yourself plenty of time. Go to bed at a reasonable hour. 8 hours sleep, is what they normally recommend. So making sure you do that. Taking some physical activity, not just before you go to bed, but maybe earlier on in the evening is good, because your body is physically tired, and that will help you to sleep. But it can be a challenge, as I mentioned earlier, because it can be a symptom of mental illness, that inability to sleep.
Wonderful. So to wrap up the show, a big thank you to Barbara Toon,